Hello, Ms. Jones. Today we're going to talk about treatment for your non-Hodgkin's lymphoma. And we're going to start off treating you with what's called ICE therapy, and that's a chemotherapy regimen that consists of the drugs ifosfamide, carboplatin, and also etoposide. And first we're going to do a little blood work for you, and then we're going to start treatment here this coming Monday. So we've got a pharmacist here, and it's Dr. Tyson, and she's going to talk with you a little bit specifically about those drugs and give you all the details that you need to know.
Okay. Hi, Ms. Jones. I'm Dr. Tyson. This is some information you can take home to look over about your regimen. If you want to follow along, that's fine. So there are general side effects that can occur with any chemotherapy regimen, and those include hair loss, infertility, and nausea and vomiting. So we're going to do some things to help prevent some of those. But your specific regimen is, like Dr. Smith said, it's 3 drugs: ifosfamide, carboplatin, and etoposide. On day 1 of your cycle, you're going to receive etoposide. On day 2, we're going to add the drugs ifosfamide and carboplatin. And then on day 3, we're going to just go back to the 1 drug, etoposide.
Okay.
So I stands for ifosfamide, and that drug works by binding to DNA, and so the DNA will then no longer be able to replicate, and your tumor cells will die. And so there are some specific side effects with that drug that are called cause blood in the urine. So we're going to give you a drug, Mesna, to pre-treat so this won't occur.
Okay.
The second drug is carboplatin. This drug works similarly to ifosfamide, killing the cells through the DNA non-replicating. And this drug has the specific toxicities of hearing loss, kidney failure and damage, and then nerve damage and nerve pain.
Okay.
So the last drug is etoposide, and this drug is going to inhibit a substance from working on your DNA that's called topoisomerase. And so when you stop that from working on your DNA, that causes the DNA no longer to replicate, and your cells will die that way also. This drug can also have the hair loss associated with it, nausea and vomiting, and some of the other similar side effects. So what questions do you have for me about your regimen?
The main questions I have is about the hair loss and the nausea and vomiting. I'm really busy, and will that affect like my everyday lifestyle? And the hair loss, will it occur quickly, or will it last?
Well, as with all chemo agents, they're known to cause hair loss because they work on your non-tumor cells. So I would expect you to see some hair loss even after maybe your first cycle of chemo. So just be prepared for that.
Okay.
And then on the nausea and vomiting, we're going to give you some drugs to pre-treat for this, so hopefully it won't be a big problem. 24 hours before you come in, you can take drugs called Zofran and dexamethasone, and then we'll send you home on a scheduled dose of dexamethasone to help prevent these.
Okay, and I will take those every day?
You would take the dexamethasone, right, every day on a schedule. Is there any other questions that you have about your regimen or anything you're nervous about?
My final question would be about the treatment, when it started and when I needed to be at the facility.
And like we said, Ms. Jones, it's going to be Monday, but it'll be at 8 o'clock. And so if you'll show up to the clinic at 8, we'll start to get you set up.
Okay.
And if you have any questions or any side effects pop up, do give us a call. And please read over your packet that we've given you, and that should inform you on all that we've talked about and other information. So we're going to fight this cancer with you. So just give us a call if you have any questions.
Okay.
Thank you.